Good morning, and thank you, Phil, for the introductions. And thank you for wearing your mask, and I'm sure observing social distancing and conducting good hand washing and all those things that we're meant to do. We look forward to telling you a little bit about East Boston Neighborhood Health Center and um, more importantly, about our response to the pandemic with our community partners. Um, thank you for the introductions. I'll give a brief overview of the health center. We're a large and complex organization. So for those of you who know us, and for those of you who don't, we'd like you to just see a little bit of the scope and size of the organization and what we do in the community. And then my good colleague and friend, Dr. Jackie Fantas, our Chief Medical Officer, will take us through our response to COVID with our community partners. And if there are time for questions, great, but that can happen, I'm sure, throughout the day. So we are a large and complex organization, but we want to keep ourselves focused and grounded at all times. We've been in the community for 50 years now. We really take that logo seriously, where it says all are welcome. And that message will be found on all the points of entry throughout the organization and its many buildings. So our mission is to provide easily accessible, high quality, safe healthcare to all who live and work in East Boston and the surrounding communities without regard to age, income, insurance status, language, culture, race, ethnicity, or social circumstances, regardless of ability to pay. It's a very serious intent on our part. All are welcome at all times. We are 24/7. So just to give you some information about the community that we serve. So we're a major provider of care. We, over the years, because of the geographic isolation of the community, have grown in leaps and bounds. Our community comes to us for everything. Our community pushes us to grow in service to their particular needs. As you can see, we service a diverse low-income community. 71% live below the 200% of the federal poverty level. That's quite a statistic. 65% are served best in a language other than English. Therefore, we have a large interpreter services department. And then you can see our market penetration rates. East Boston, 73% to 75% of the residents of East Boston come to us for their care. In Chelsea, it's 37 to 40%. Revere, around 30%. Winthrop and growing, around 27%. And we now consider Everett in our crew area communities. And just to note, this past July, we had the absolute good fortune of adding the South End Community Health Center to the health center. We merged. And so we now see over 100,000 patients. And it's upwards, to 115,000 or so, over and across 300,000 visits or more a year. And with the merger with the South End, we have over 1,200 employees. So this is the array of services that you would find at the health center. We have a very, very large and complex primary care department featuring adult medicine, family medicine, and pediatrics. And they're the equivalents of those departments at the South End Community Health Center as well, which provides a lot of primary care. OBGYN women's health in both locations. We have a integrated behavioral health care model, which we're very proud of. So our behavioral health clinicians, now with the South End in mind, we have over 40 behavioral health clinicians throughout the health center. They're all integrated into primary care, where they serve the patients along with the primary care team in a very much integrated way. We have a dental service in both locations. We're one of the few community health centers, federally qualified health centers in the nation that has its own emergency department, which is quite a cornerstone for our community. And we've been operating 24/7, 365 since we opened 50 years ago. We also have HIV services. We have addiction services in both locations and over 300 patients that we serve. Again, a large interpreter services department, lab, pharmacy, radiology, a number of specialties, vision and dental, nutrition in both locations. We have the Student Wellness Center at the East Boston High School that's gone virtual right now, but an integrated program in the high school, and 3 other school-based health programs through the South End. We provide a vast amount of care navigation services to serve our patients through the Community Resource and Wellness Center, which has become really a food distribution center under COVID-19. And we also have, with the acquisition of the South End Community Health Center, specialty or long-term behavioral health. So a continuum of care for our patients. So this is our strategic plan, which sadly is coming to an end. This was 2020 vision, but the goals below have not and will never come to an end. And I just call your attention to, we're re-upping our strategic plan. It's reimagining 2025, and it's in development. And I would say one of the silver linings, if there could be any, to COVID-19 is lessons learned, tailoring care in this world of telemedicine, telehealth, which we had to rapidly switch over to. And in behavioral health, we're up over 90% delivery of telehealth, telepsychiatry, and 60% or better in medicine. These were our strategic and are our strategic goals. Quality. We want to improve the quality of the health of our patients, but really everybody in the community we serve, every individual and family. We want to be an efficient care delivery system, and growth is always something that we're doing. And we've always been pushed to grow, as I said, by the community. The only difference is we now want to make sure that it's sustainable growth. And then we have a one company vision. So I'll just end here with our vision statement, which is working together to make our neighbors healthy. And I turn it over to Dr. Fantas.
Good morning. Phil, I greatly appreciate your advertisement for good mask wearing and social distancing. As I move into our response to COVID, that's the perfect segue into our response as the health center and teaming up with our community. As Michael talked about, is what we do with the health center. Our mission statement, thinking about everything that we provide for the community. We have an over 70% penetration into East Boston. And so we had a very vast response to COVID, which we feel is a good example of how do you respond to a disaster in East Boston. We have a command center at the health center, and so we very quickly stood that up. Our senior team came together in daily huddles, sometimes more than daily. We kept everybody, a multitude of things to keep all of our health center, our over 1,200 employees at the health center. We need to keep them informed. And we did that through weekly managers meetings, multiple town halls with all staff, meeting with community partners, Boston Public Health Commission and the City of Boston in particular, to disseminate ways to stop the spread in our community. And development of a COVID-19 SharePoint site so that we could post all of our dashboards and other items to keep people educated about the COVID pandemic. Um, uh, the most important part of this slide, this just showed all the points that we had to address with each of our senior management meetings to make sure that everything was coming together, all the way from governance within the health center, all the way down to the community. We needed to make sure that we were alongside our community partners to make sure that we had a good response to this terrible pandemic. So we did a lot of things. We knew that, on March 13th was a big day, I think, for a lot of people. We were notified that we needed to stop all routine services and decrease the foot traffic in our health center. However, being a big provider of health, the major provider of healthcare in East Boston, we knew we had to keep our doors open, but do it in a very safe way and provide the best medical care that we could in this time of crisis. And so we centralized our direct patient care services to 2 main buildings. And we did that because if everybody remembers, back in March, April, May timeframe, personal protective equipment was very short. And we had to conserve that, and also conserve our staffing. We didn't know what was going to happen with our staffing, the same as in the community. All of our staff live in the community, and we had to prepare for illness within our staffing. And so we, being a large health center with 2 main buildings, we could provide safe COVID care in one of our buildings and safe well care and the routine care that needed to continue in the other building. One of our major setups was our influenza-like illness clinic. That was, we strategically located that just exactly next door to our emergency department. Our primary care providers were not providing the routine care that they had. So we had the ability to staff our influenza-like illness clinic, and that was for 2 reasons. Was to be able to keep those that were potentially infected or infected with COVID in an isolated place, and provide the good care for them, and conserve our personal protective equipment, and keep only a few of our staff seeing those patients so that we could conserve the PPE. In our emergency department, we set up both hot and cold areas. That was very important in order to be able to continue to care for folks that did not have COVID or COVID symptoms in our cold area to keep them safe. Well, child care and OB care had to continue. Our 20 Maverick site was considered our cold building where we could continue well child care. One of the things that we take great pride in at the health center is our immunization rates of our children, and take that very seriously. And one of the worries about the pandemic was that we would not get our children immunized and exchange one pandemic for another pandemic or epidemic. And so we needed to keep our well child care and immunizations going for our children, and to do that safely. And also our prenatal patients, pregnancies progress even in a pandemic, and we needed to do that safely. We had to reassign staff. Our staff were more than fantastic. And they knew that sometimes their jobs needed to be reassigned. We had some, specifically a couple new jobs in the health center, lobby screeners, where we screen every person coming into the health center. And then we had a robust testing response, which I'll talk about a little bit later, and we had to staff those testing sites. We have a community resource and wellness center at the old library that greatly expanded its food distribution for the community in partnership with the Red Cross. We had immediate implementation of telehealth. We had been talking about telehealth for a long time. And like I always say, in like 10 minutes, we stood it up, as well as many other healthcare systems. And that has been a huge way that we could continue to care for our community in a very safe way, and address the needs of our high-risk population, and of course, chronic disease management. We had exponential growth of our behavioral health visits. Behavioral health visits needed to continue because of the pandemic. We also did a mobile van for immunizations. We created registries to track our most vulnerable populations. We provided care packages to thousands of patients. We had our testing was set up. We partnered with Boston Public Health Commission and the city of Boston, and set up initially for first responders, then city workers, and then all community members. Contact tracing and testing ambassadors program with the Mass League and Partners in Health to do all the contact tracing of our positive test. Community education for quarantining challenges for an immigrant patient population, overburdened by positive rates. East Boston was very overburdened by positive rates, especially in April and May timeframe. And we had to overcome the fears about testing. We did this with education through social media, teaming up with local politicians, local community online forums to include Spanish language media. We did several testing sites. We did our campus division, and we have ramped that up and are doing about 350 to 400 tests per day, currently at our 79 Paris location. We did mobile testing. We have a mobile van, and we have gone we've used a geo mapping tool to be able to find testing deserts in the neighborhood and bring the mobile testing to them. And we have teamed up with the city of Boston for citywide testing and have toured around the city, providing 300 to 500 tests per day in the community. This is just an example of the number of tests that we have been providing. We've been doing 2,000 to 3,000 tests per week for a very long time. And we track very closely. We have everything within our electronic health record, and we track very closely the positivity rate in our communities, as well as in our symptomatic patients and asymptomatic patients. And this is very important also in the, so now that we've progressed to fall timeframe, we've been anticipating a dual issue of influenza and COVID this winter. It's very important that all of our staff and community are vaccinated for influenza to protect each other. This year, like I said, is compounded by the COVID pandemic. The symptoms are very similar. If we can mitigate influenza as much as possible, it would help us in our response to COVID. Therefore, we established, we had a very robust flu campaign. We've always have a flu campaign every year. And this year, very robust. And we, for our employees in particular, we usually try to get a 90% compliance by December 1st, but we wanted to speed that up and get a 90% compliance by the 31st of October. And we did that. So we are very happy that our employees are immunized against influenza. In addition, we've given over 16,000 influenza vaccines to the community. And in addition, we offer flu shots at our testing site, which has helped with community influenza vaccination. So this was a very important process to include in our COVID response. So that has been our COVID response, and I'll be happy to answer any questions. Thank you very much for your time.